Amy Tyberg. I'm an assistant professor of medicine at Weill Cornell Medicine. T-EUS is kind of the new era of advanced endoscopy, which uses endoscopic ultrasound, which has been around for a long time in a new and exciting way. The way that we use it is to actually visualize different structures in the abdomen from within the stomach or the small intestine and create connections between different organs that otherwise would have been impossible to do, all from the inside. I think what I like the most about therapeutic EUS is what it allows me to offer my patients. In the past, patients really had options of medications or medical management or external drains or surgical interventions, and therapeutic EUS offers us something in the middle where we can still achieve great outcomes, but we can do it all from the inside without having to undergo any more invasive types of procedures. There's a lot of therapeutic EUS procedures that we do. I think they can really be categorized into drainage types of procedures and creating new connections and stenting between two organs. One of the most common procedures that we do is draining of what's called the pancreatic fluid collection, which is when patients develop inflammation of the pancreas. Sometimes they can get an area of pancreatic debris and fluid that gets walled off and separated from the rest of the pancreas. And really the only way to treat that kind of condition is to drain it. In the past, that would require either an open surgery or a drain going from the outside through the skin into the fluid. But now we can do a drainage all from the inside so that the drainage stent goes from that collection into the stomach with nothing from the outside, so that if someone's walking down the street, you would have no idea that they actually had this drainage stent in place. That's probably the most common therapeutic EUS procedure that we do. I think my favorite therapeutic EUS procedure is draining of the gallbladder. So many patients end up with inflammation of the gallbladder, and traditionally this is managed with surgical removal of the gallbladder, and certainly that is still the first gold standard treatment. But many patients that develop problems with the gallbladder, for whatever reason, are too sick to undergo surgery, and I think we now have the ability to drain the gallbladder from the inside so that this person who's very sick from their gallbladder inflammation can then leave the hospital with a stent that can really stay in, at this point, almost forever, and avoid having to have an external drain or undergo a high-risk surgery or be on antibiotics forever. So I think that's probably the one that's changed the field the most. The patient that comes to the front of my mind is a woman who was suffering from recurrent attacks of what we call pancreatitis, or severe pancreatic inflammation, causing such bad abdominal pain that it had to be managed in the hospital. And we, with imaging, realized that this pancreatitis was due to a narrowing in the tube or the duct that drains the pancreas, called a stricture. Traditionally, strictures are managed by putting a stent, which is like a drainage tube, across the area of narrowing that allows everything from behind the obstruction to drain normally into the intestine. But in her case, putting a stent was not feasible because the narrowing was so tight that it really prevented any access to the upstream part of the duct via conventional ERCP, where we go from the intestine into the pancreatic duct along the normal drainage route. One thing that we were able to offer her is a T-EUS procedure called EUS guided drainage of the pancreatic duct. And what we did was, from within the stomach, we did an ultrasound to visualize the part of the duct that was upstream of the area that was blocked, and we put a stent from that area of the duct into the stomach, allowing all of that pancreatic material that wasn't able to drain and kept causing these recurrent attacks of inflammation to now become decompressed. Ultimately, in a follow-up procedure a couple months later, we were actually able to then remove that stent that was in that part of the pancreatic duct going into the stomach and put a traditional stent that was all within the pancreatic duct and draining normally into the duodenum across the area that it's supposed to go. So by decompressing the duct, we ultimately were able to succeed in preserving her natural anatomy and allowing her pancreas to drain. And since she's had these procedures, she's had no more attacks of pancreatitis. So really a success story. You know, as I said, I think therapeutic EUS is sort of the new wave of advanced endoscopy. And, you know, right now we're constantly evolving and changing and using creative ways to offer minimally invasive options for our patients. And I think as industry continues to provide us with tools and different technology to improve our ability to do these procedures, the field is just going to continue to explode. I hope doing exactly what I'm doing now. You know, I really feel fortunate that I was able to learn these types of procedures, and that I now feel comfortable offering them to my patients, and I hope to be doing that, you know, for many more years to come.